Now to this morning's health check. Acne is the most common skin condition in the U.S., with approximately 50 million Americans suffering from the disorder. Treatment methods can vary from preventative to corrective, with some impressive results. So here to break down some of the available treatment options is board-certified dermatologist Dr. Sherry Ingraham. Thank you for coming in.
Hi.
And let's talk about this because it's something that we don't talk about a lot. We see all the commercials, people try to deal with it on their own, but sometimes it's good to see a doctor.
Absolutely. The perception is often that acne is a normal part of growing up, but unfortunately it's still considered a disease. It needs to be considered a disease by the public and other physicians because it can be associated with long-term emotional and physical scarring.
There are a lot of things we treat with over-the-counter products. Take Tylenol for headaches. We, may use some of those lotions or something like that for acne. When do you know that you need to see a physician?
Good question. So if you have mild, what we call comedonal or early acne, you can try the over-the-counter products. However, if you have any scarring, if you have cystic lesions or significant pigmentary change, it's time to move on and see a dermatologist.
Do you have patients that are surprised that they have acne even as adults?
Absolutely. I can't tell you how many times a day I'm doing just a skin exam on a patient and I mention, would you like something to treat that acne? And so many times, especially women in their 30s and 40s and 50s, say, I'm so glad you mentioned it. I never had acne as a teenager, but I have it now.
So what about some of what we might consider more extreme or extensive things like chemical peels? Who's a good candidate for something like that?
Really, because there are a variation of chemical peels, everybody is a candidate. If you have mild comedonal acne where you have whiteheads and blackheads, peels are a great way to open up all those pores and really accelerate healing. And then if you have deeper cystic lesions and scarring, they're a great way to stimulate new collagen. And really one of the key parts of preventing and treating scars are chemical peels.
So let's talk about, if you have a loved one who has acne, it's really difficult to talk about. How do you open up a conversation about that?
That is a very, very good question. Oftentimes I'll just say to a patient, does this bother you? Is this something that you've thought about treating before? Because you don't want to, of course, say, ooh, look at that.
Right, look at that on your face.
But there's so many
hard.
simple things you can do to prevent it from getting aggravated, like using sunscreen, washing with a gentle cleanser once a day, or even bringing one of your loved ones a product and say, why don't you try this? I mean, handing them the dermatologist card isn't always the first place to start, but you're opening up that conversation.
One last quick question, because people talk about this all the time. What about prevention? Are there foods, are there habits that lead to acne that people can really just avoid?
Absolutely. A few years ago, the answer was we don't know. Now we do know that foods that are pro-inflammatory, so foods that are sugar-based, foods that are dairy-based, can stimulate insulin-like growth factor, and those can stimulate inflammation, which we know is the hallmark of acne now. So I tell my patients, of course, avoid sugary, sweet foods and drinks. Try and get them off of dairy when possible. And I also recommend anti-inflammatory foods. So your green teas, your blueberries, your pomegranates, all of those things that can confer an anti-inflammatory benefit can absolutely help your skin.
All right, and of course, healthcare too when it comes to just washing the face.
Washing your face. Those studies have shown washing once or twice a day is just as beneficial as 3 or 4 times. It's not because you're dirty. So I always say wash at least once a day with a good cleanser.
All right, with a good cleanser. I like that. Disclaimer there on the end. A lot of information in a short time, but Dr. Ingraham, thank you very much. If you missed any of the doctor's information or you'd like to see the segment again, you can head to our website. It's abc13.com. We'll post a link to watch the interview later today.